There has been a change in the streets of downtown Victoria. Maybe you've noticed but don't know why. Addicts are moving to a new drug of choice, moving away from heroin to crack cocaine. BC's Centre for Addictions Research says it's not a good move either. It means an increase in mental illness, leaving downtown Victoria a sicker and more unstable place. But police and the Vancouver Island Health Authority don't entirely agree with that. They say the increase in violence downtown is the result of something else. A legal substance that's readily available at hundreds of locations. News reporter Stephen Andrew has the story. He joins us live. Stephen.
Hudson, that substance is alcohol, beer, wine, coolers, anything that can help fuel the party atmosphere in downtown Victoria most nights. But really, one of the biggest issues is the scene that we're about to show you that occurred outside our newsroom a few days ago. And it's a scene that people think that downtown is no longer safe. It appears the economy is affecting everyone, including drug addicts. Cheap and readily accessible, addicts are making cocaine and crack cocaine their illicit drug of choice. Over the past 5 to 10 years, the Centre for Addictions Research in BC says there has been a move away from opiates such as heroin to cheaper drugs.
Crack cocaine, you take a lot of that over a period of time. You don't sleep, your mental health suffers, your emotional stability suffers. People start becoming psychotic and paranoid. Also, those kind of stimulant drugs make people more prone to risk-taking.
The upside to the change is fewer deaths due to overdose. But the Vancouver Island Health Authority says the more popular psychotropic drugs present their own challenges.
Certainly Hepatitis C virus is still there. It's more infectious than HIV, so it's even a concern with people sharing crack pipes that they're going to spread saliva or blood between users if they're sharing.
And there is also the issue of psychosis. Users can often spend days without sleep, putting them in a delirious state, scenes which have led to a perception downtown Victoria is not safe. Victoria police are seeing increased violence on downtown streets, but they say they're not attributing that to the use of crack cocaine and other illicit drugs. They say it's due to alcohol.
So it's not just sort of street-level drug users, it's, regular people who are coming downtown drinking too much, and then, the direct result is, more assaults, more impaired driving, more mischief.
Getting a handle on that has proven tougher for police and local politicians than originally thought. More enforcement and easier access to late-night transit are just two of the solutions being worked on. But the health authority says when it comes to dealing with severe drug use, progress is being made.
The advent of the assertive community treatment teams that actually go in and are available 7 days a week, see people on the streets and work with them intensively. They can visit them 2 or 3 times a day if needed. That kind of intensive service is what's required.
And for the success to continue, VIHA says sustained funding is needed, an investment that could save millions in healthcare and policing costs down the road. Now, Hudson, those community teams are actually building relationships with those addicts and moving them into what they call wet housing. Unfortunately, that's where other addicts may be using drugs at the same time. They then try to get them into treatment programs and then into more permanent housing. VIHA acknowledges that's a long-term solution and one that requires the coordinated effort from police, probation, health officials, and also social service agencies.
All right, Stephen Andrew, thank you.
You're welcome.